chapter on diabetes. This is supplemental to Chapter 4, and it is covering pages 163 to 167 in your textbook. Diabetes coding is really where you're going to have to put to work your use of and knowledge of anatomy and physiology. So let's get started. The pancreas produces insulin, which is a hormone that lowers blood sugar to help the body's cells metabolize fats and carbohydrates. Diabetic patients have higher than normal levels of blood sugars, either because the pancreas is not producing the insulin or because your body is not correctly using the insulin that your body is producing. Diabetes is broken down into type 1, type 2, gestational, and secondary diabetes. Now we're going to take a look at each one. Diabetes type 1 is when the patient's body cannot produce insulin. It usually develops prior to puberty. That's where it got the name that it's also referred to as juvenile diabetes. Type 1 diabetic patients always require insulin because their body is not producing it. Type 2 diabetes is the most common form of diabetes. It's when the patient's body is unable to properly use the insulin that the body produces. It is sometimes referred to as adult onset diabetes and can be controlled with diet, exercise, and oral medications. If those treatments don't work, however, a type 2 diabetic patient may also require insulin. Whenever a type 2 diabetic requires the use of insulin, in ICD-9 you want to add the additional code of V as in Victor 58.67, and in ICD-10 it would be Z as in Zebra 79.4. If a physician does not document the type of diabetes, it always defaults to a type 2 condition, and that is the same whether it is in ICD-9 or ICD-10. After you determine whether or not the patient has type 1 or type 2 diabetes, the next thing you need to look at is whether it's controlled or uncontrolled. Your physician must clearly state uncontrolled in order to assign a proper fifth digit of either a 2 or a 3. This is in ICD-9. A statement of poorly controlled or not adequately controlled does not qualify as sufficient documentation to code as uncontrolled in ICD-9 coding. ICD-10 does not use the same terminology as in ICD-9, so in ICD-10, instead, they have chosen to use the term diabetes with hyperglycemia, which simply means the patient is diabetic and that their blood sugars are high. When in doubt, query the physician for clarification, and when we switch over to ICD-10, refer to the official guidelines for the differences. This is what your fifth digits will look like while coding in ICD-9. Your fifth digits, your options are a 0, 1, 2, or 3. Remember, if the type is not stated, it defaults to type 2. If it's uncontrolled, it's going to either be a 0.2 or a 0.3. And your documentation has to clearly state that it's uncontrolled in order to get the use of your fifth digit of your 2 or your 3.